Welcome to the Low Carb Conferences podcast. I'm your host, Dr. Jeff Gerber, and today our special guest is Cory Jenks. We're excited to have Cory on the podcast, but more excited as he'll be our MC at the conference in February. So how's it going today, Cory?
Never better. I get to talk to you about the conference and metabolic health and humor and the state of healthcare. It's a beautiful, chilly fall day in Tucson, so I'm ready to get after it. This is going to be a lot of fun.
Yeah, it's good stuff. I'm glad it's cold down there. We had our first snowstorm last night here in Denver, and it's actually beautiful, but chilly.
Yeah.
So a little more about Cory. Cory is a pharmacist, an author, an improv comedian, speaker, and a nutrition advocate. Now, when I first met Cory, he told me that he teaches healthcare professionals improv. And like a deer in headlights, absolutely clueless, I asked, why the F word do healthcare professionals need to learn about improv? Well, I'll let Cory explain that in a minute. So Cory, if you can provide some more background and tell us about your personal and professional interests.
Sure. Yeah. So I am indeed, you had a lot of pharmacy comedians to pick from, and you picked me. So I really appreciate that. Because as we know, pharmacists just known for our sense of humor, right? But I've been a pharmacist for 11 years. I'm originally from Tucson. I went to pharmacy school at the University of South Carolina. I have my little Gamecock sweatshirt on today. But I've been practicing for 11 years back here in Tucson. I've worked and currently work in primary care. So I work as a pharmacist that actually can prescribe medications and do what we call chronic disease management. So, but with this audience, I'm sure you're much more into chronic disease reversal. So that's the way I like to approach things as well. But as Dr. Gerber said, I'm also a comedian. So I've been a practicing improv comedian now for 10 years. And it seems very unrelated to healthcare, but I promise you, there is a big connection between the skills I use on the stage and the skills that I think are actually sorely lacking in healthcare. And then he did mention I'm an author. So over my right shoulder here, I wrote this book, Permission to Care, Building a Healthcare Culture That Thrives in Chaos, where I go into the details of how I use these skills of improv and how anyone in healthcare can use them as well. So by the time that you're done reading that book, you won't say, what the blankety blank does improv have to do with healthcare? So, but I, as he mentioned too, I'm an advocate for nutritional interventions. It's the way I approach my patients, my personal life. And I think that's about as much as anyone really would want to know about me until you get to know me in person. I have a wife that's a nurse practitioner, so we're a healthcare family. And she's improv trained as well. She's jiu-jitsu trained, I'm not. So I listen to everything she says for fear of retribution physically. So, but no, she's great. And this is what I love doing, is talking about that intersection of that personal side of healthcare with the clinical side.
Oh, great, Cory. Well, I listen to my wife because she's a lawyer and I never win the battles. Plus, she could probably beat me up as well.
Yeah. So,
but yeah, Cory, it's great. I would describe you as a social skills coach.
But that is, I would say I've never heard that before, but I'm actually going to probably start using that social skills.
Yeah, thinking about it, it's better that you teach people improv because they don't quite understand it. But at the end of the day, it's a social skill coach. And, not only healthcare professionals, but so many people need to learn how to communicate better and connect with one another. And that's what you bring to the table.
Yeah, thank you. And that's really what improv comedy is. And if anyone who's listening has never heard of improv comedy, it's essentially a form of comedy where everything is made up. And so to be successful at that, to try to get groups of strangers to laugh while working with a group of people, you have to be able to listen very well, communicate really effectively, live in the moment, and work as a team. And if you think of what healthcare could be, if we did it right, it's a team sport. We're working together. We're listening to the patients. We're communicating with our colleagues. We are relying on different disciplines, doctors, pharmacists, nurses, nutritionists, to put the patient first. And that's what winning looks like. And improv laughter is what winning is. And so that's the parallel I've taken to, as you say, kind of teach these social skills to other healthcare professionals that might be a little lacking in that.
Well, a lot of us are lacking. And, I mentioned before the podcast that, I realize the importance of humor in the healthcare setting, because, sometimes you have some serious things to discuss, and it just lightens the mood and makes it easier for people to communicate. In fact, I have a really good friend who's an oncologist, and he is hysterical.
Mhm.
And, I would often tell him, look, you're in the wrong profession, my friend. And he would say, no, Jeff, my patients love me.
Yeah, and I think humor is a great tool for kind of breaking down that barrier of provider to patient. It kind of helps you humanize yourself with that patient, helps you get them to helps with the trust factor. So a patient comes to us, they're trusting their health, their life with us, and they need to feel comfortable sharing the things that are going to help us help them. And oftentimes, using that humor to relate to them, uh, can really break down the barrier and make them feel more comfortable, getting them to smile. Like, think of the last time you went to the doctor, that isn't, of course, you, a generic doctor out there, and you actually smiled and thought that was a great experience. And unfortunately, I talked to friends, family, I've had personal experiences where that's just not the case. And so if we can turn that experience into something that's enjoyable for the patient, and then for those of us in healthcare who we're all burned out, if we can enjoy our jobs a little bit more, I don't see any downside to that either.
Sure. Well, you and I both are in the primary care setting, meaning that we're kind of in the trenches, the first one to encounter the patient. And so it is always our job to warm up to the patient, but sometimes it's harder for specialists and surgeons and so forth. But,
Mhm.
for myself, I really love to warm up to the patient. And sometimes I ask too much personal information because it does help me to connect.
Mhm.
And if the patient says, okay, shut up, that's enough, let's talk about my medical problems, I get it. But
Mhm.
you have to really connect before you can really ask the hard questions.
Yeah, I find that when I'm working, when things are going well, I'm having conversations about gardening, grandkids, the World Series, and in between those, you're getting the details that are going to help, instruct what your plan is. You're getting to know that person as not just a patient, but as a person. And then I'll say like, oh, that's really great that you're out gardening. How's that affecting your blood sugars? How active are you doing? And you weave in what they care about, into the conversation, finding out what their why is. Why do they want to come and get healthier? Is it to be more active? Is it to sit and watch The Price is Right? I don't know. These are the things that we have to investigate and find out, as you say, in primary care.
Yeah. Oh, you mentioned the World Series. Yeah. Philadelphia, the Phillies. That's where I'm
Mhm.
from. Yeah. They're in the
Okay.
World Series. And also the Eagles, I should mention, are undefeated in football. So Philadelphia's having a really good year.
Well, see, this is why we bring these things up. Now I see a big smile on your face. You've relaxed. You've related to something. You're able to relate to something you know much about. I'm a Cubs fan. We don't get to see a lot of World Series, so when we do, it was very enjoyable. This one in 2016. So
Yeah. Yeah. Well, excellent, Cory. So do you actually go out? Do you have a formal program where you educate healthcare professionals? Is it more a read, or how does that work?
yeah. So what I do is it really depends on the organization, the group that I'm working with. I can go and I can talk to a group, and I just sit up on stage and I talk to a group, and we laugh along together as we go through some of the backgrounds, some of the improv basics, there's actually literature supporting the use of improv for medical training. So we like evidence-based medicine. I joke that I do evidence-based comedy. So we can go through and I can talk to a group, but I also have programs where I go and we work together as a group. I get the people not just sitting there watching and learning, but they get up and they start performing the games and activities that I would do as an improviser. And then we talk about how those relate to healthcare, how those relate to a patient interaction, how those relate to healthcare leaders. So I talk to healthcare leaders too, and talk about building a culture of utilizing these skills. The main thing that we learn in improv is this idea of yes and. We say yes and we build together. How can we build a culture of yes and? And I think that for me, it's lightened my career. It's made it much more enjoyable. So yeah, so I'll go talk to a group, and then I have the workshops that I work together as well. And I have the different ones that I have kind of set up. But I'm an improviser, I adapt. And so when I go and work with the group, I adapt to that particular group's specific desires, specific needs, whatever time they have, and the group size they have as well.
Excellent. Well, I'm going to have to get a copy of your book, Permission to Care, as well. And so I can always learn a bit more.
Yeah, I've been told by my mother that it is, quote, actually pretty good. So she was I joked, she read it and she thought it was actually good. And I thought that is the nicest backhanded, like passive aggressive compliment I could have gotten from her. But
Yeah. So, so does your mother think that you're special too?
um, she used to, until I met my wife, and now she thinks my wife's the special one. And then she has a couple of grandkids and they're the special ones. And I'm the person that drives them to her. No, she still thinks I'm special, but there's
Okay,
a lot more special to share now.
okay, just checking on that.
Yeah.
So yeah, tell us how we decided to have you be the MC of our event. This is you've been an MC before, but
Mhm.
this is a first for you and actually for our conference.
Yeah, so I have emceed hundreds, if not thousands, of comedy shows at this point in my career, and it is one of my, like emceeing is a performance, but I'll MC a show where others are performing. But I think the fun part of the emceeing is to interact with the audience, to get the energy up, to make sure everyone is having a good time. When you go to a comedy show, you want to have a good time. When we go to your conference, we're going to have a good time. And we kind of got connected through a mutual contact who had met me at another conference and was like, pharmacist that does comedy. That's weird. They didn't go into such specific profane details as you did, but they were able to connect us, and we met. And despite the initial kind of confusion of how I blend the two, we decided to move forward and try something new with your conference, to have me with my clinical background be able to introduce speakers and kind of run a few of the different events, but also with the ability to infuse a little bit of the humor side of it as well.
Yeah, well, some might argue that our event is indeed a comedy show as well,
Yeah.
but
Well, in looking at the list of speakers, I've seen so many of them speak before, and they are funny. I don't know if like metabolic health makes your brain funnier, but like when I go to these conferences, they're highly informational and they're highly entertaining. My job is easy because you have such a great cast, or not cast, but a great lineup of speakers who know how to connect with an audience, know how to relate to an audience, and know how to have fun. I think that's one thing in healthcare we've forgotten, that even though it's a job and it's a hard job, like we can have fun doing this. And I think a lot of the fun for us too, like, is when patients get better. So let's learn the information to help patients get better, and that'll make it even more fun.
yeah, well, that is indeed the point. This is our sixth event, and we've wanted to make it exactly like you said, educational and entertaining along the way. And we try and emphasize that because the information can be really boring.
Mhm.
And if you learn how to deliver it in a fun and entertaining way, then you've got the audience's attention and they're looking at you,
Mhm.
and they're going to retain the information.
Yeah. Well, and it just reminds me of a conference that I gave a workshop at, and one of the participants was a pharmacist. She came up to me afterwards and she said, "This is the first time I've ever smiled at one of these conferences. Like, we're expected to be so professional and stiff, and like I don't know when professional meant like not enjoy yourself or even smile." And so that actually made me really sad. Like, we have to get CME, we have to get these credits. That's fine. Is there any reason they have to be so dry and uninteresting? And so, as you said, we can take this information and make it more engaging, make it more fun, make the whole event, a much higher energy event than you would get at a typical, air quote, medical conference.
Yeah, we have professors that'll be speaking at the conference, and
Mm.
they've given hundreds and hundreds of lectures around the world, and I think that they get it, that the atmosphere at our conference is both educational and fun, and that's the way it should be. And we've really been looking for someone like you all these years, and so we're just delighted. I'm just worried that you can't keep up with a 72-hour event. I think you need some help with doing the MC work.
Well, I will certainly do my best. I have a 2 and a 4-year-old, so I'm very used to going all hours for long periods of time. And I'm living that metabolic health life. So I feel I'm almost 36, and I feel I have more energy now at almost 36 than I did at 26. So and here's the thing too. It takes a lot of effort. It takes a lot of energy. But the cool thing about energy is I feed off the audience. I feed off of you, the crowd, the speakers. And when you see the people enjoying themselves, when you see a crowd light up like that, that helps keeps you going too. So will I be tired by Sunday? Yes. And I'm expecting that, and I'm excited for that, because that is the most satisfying kind of exhaustion, is when you really put yourself out there to help a cause, to help patients, to help people enjoy themselves, flying from all over the world. Like, that's very satisfying, and it's worth the exhaustion and the effort for sure.
Yeah. Well, I think I joked a couple of weeks ago to you that it's why Elvis kept going, because he got up on stage and he loved his audience. He could see his audience, and
Mhm.
it gives you energy. Unfortunately, he burned out.
Yeah, well, I mean, I will not be doing any residencies in Vegas after this, as far as I know. So I will go back to my boring day job and my lovely kids. So that'll be okay. But that's what, that's the anticipation and the excitement of the event like this is what,
Yeah.
gets me excited and gets me ready to go and keep the energy up for
Well,
4 days.
well, great, Cory. So it is a lot of work, as you said, because you really have to review all the speakers, and you have to do introductions.
Mhm.
But honestly, I think that we will create some breaks, and we'll have some other people do some of the MCs during portions of the day, and we're going to work that out as we get closer to the event. And
Mhm.
as you know, I work really hard, and by the time we get to the event, I like to do an introduction and then just sit back and see that everything's running smoothly, rather than me running up on stage to introduce
Mhm.
speakers and do Q&A sessions and so forth. So again, we really appreciate you being there, and the audience is going to love it.
Yeah, I think so, and I like what you say about sharing some of those duties too. That's something I've learned as an improviser that I've taken to personal life healthcare, is that team approach. It takes a whole team to make something a success, whether it's an event like yours, whether it's an open heart surgery. We're talking about a family member of mine that recently had that, and improv has helped teach me to lower my ego quite a bit, because it's all in the service of that event, of that experience people are having. And so when I'm on stage doing an improv scene, sometimes I get to deliver the punchline, and sometimes I'm setting up the punchline. And I don't care if I get to deliver it or I set it up. I care that the audience laughs and has fun. And that's that's a lesson that we take to healthcare. You take from my book to healthcare. You can take the life with you as well. Is um, sometimes you get you get to slam dunk it down, and sometimes you're throwing the alley oop up.
Yeah. Well, there's a lot of other people that love to get up on stage, and we love to get as many people as we can up on stage during the event, just so they feel that they are
Mhm.
participating. So, keep that in mind. Don't feel that you have to be up there every second of the day. And in
Mhm.
addition, you're going to help us with some of the fun activities. We were talking about that. Berkeley is one of our managers of the event, and we're still working on some of the fun things we're going to do on Saturday night at the dinner.
Mhm.
Not to give any of it away, but we need someone creative like you to help us figure it out.
Yeah, and who would have ever thought that you'd be going to a pharmacist for creativity, right? I've been able to tap into this right side of my brain that it was dormant for the first 25 years of my life. It's pretty cool to be able to utilize that in a fun way as well.
Yeah. Well, I guess I have to back up. How is it that you realized you were a funny guy?
I don't know if I don't even know if I'm a funny guy yet. So the trick about improv is I'll tell people I do improv comedy, and they're like, "Well, I can never do that. I'm not funny." And I say, "Well, I'm proof you don't have to be really funny to do it. If you follow a few simple rules, listen and stay in the moment, you can be successful as an improviser." I mean, I've trained people who are doctors, pharmacists, nurses, engineers, and it's people who are really bright who can listen and follow along can be very successful and very funny. For me, it wasn't about like, oh, I think I'm funny, I should do this. It was, I want to do this because it seems fun, and in doing it, you can develop that sense of humor, grow that humor muscle, kind of identify those moments of, oh, this is what that joke should be right here. And it just has been years of playing on stage and practice. And then honestly, when you're having a conversation with anybody, whether it's someone checking you out at the grocery store or in line at the airport, every moment that you are going around, you're improvising. So if you really pay attention to what's happening, you can identify the kind of funny things that are happening in the world.
Sure. Over the years, I've kind of just injected humor wherever I'm at. You have to be careful. I had this friend I called him a country bumpkin here from the Midwest, and we traveled back to New York City
Yeah.
to actually watch US Open tennis. And he's making friends with everybody on the subway, and he's jovial. And I said to my friend Alex, I said, look, when you're in the big city on the East Coast, you got to keep your head down and don't make eye contact. But we did survive, and it was a fun experience
Yeah.
interacting with the New Yorkers.
Yeah, it is. It's interesting when you go to those different regions. I'm from Tucson, so I'm used to a lot of big open spaces. My wife's family's all from the Midwest, and so visiting the different, visiting New York was a kind of a. I like personal space, so it was a challenge for me. And then I went to college in the Southeast, where it was a very friendly, open campus, very friendly people in the Midwest. And not saying New Yorkers aren't friendly. So if you're listening from New York City, I'm not saying you're not nice. It's just a different culture and attitude, and that's acknowledging your surroundings and identifying that is just part of going through life.
Well, look, I'm from Philadelphia, and sarcasm is an act of love in the East
Yeah.
Coast. That's what we say. So the more sarcasm, the more love.
Mm-hmm.
So yeah, well, look, let's shift gears a little bit and let's talk about the state of healthcare according to a pharmacist. So what's been going on?
In short, it's pretty bad. So I think if you're listening to this, you're aware of the challenges that the country faces with our just baseline health. We're obese. We have a lot of diabetes. And what I'm seeing in the pharmacy side, and I don't work in a retail pharmacy where you're going and getting prescriptions filled. I'm seeing it in kind of like you are in the front lines of primary care. But it's just really interesting to see, having practiced in a couple of different healthcare organizations, the emphasis on prescribing and the emphasis on utilizing pharmacotherapy for managing, and air quote, managing these chronic diseases that didn't exist 50, 100 years ago. And so the expectation is that we're, as a provider prescribing, the patients come to us with this expectation of receiving a prescription. Whenever I tell a patient, like, we can get you off your medicines, would you like that? They're like, no one's even provided that as an option before. It's just so expected, that problem drug, problem drug, problem drug. And in fairness, when you have 7 minutes with a patient, what the heck are you supposed to do? You can't, you can't, I won't say you can't, but it's very hard to get to the root cause and to some of the deeper issues that are leading to the issues that are in front of you that are requiring the prescription.
Yes. So I'm not familiar with a pharmacist seeing patients in the primary care setting. Is that something unique to the state of Arizona, or just I'm not unfamiliar with it?
No, so I was at the VA for a number of years, and it's something that I think VA pharmacists have been doing for a couple of decades. It's called a collaborative practice agreement, or a scope of practice. And the way it works is essentially a physician or a nurse practitioner or whatever provider agrees and signs this agreement that a pharmacist can manage certain diseases under their scope of practice. So they go see their provider, say they have diabetes, and they start them on metformin, and they say, okay, I want the pharmacist to follow up with the patient. They can adjust the metformin dose. We actually have prescriptive authority to write additional medications. For me, my goal is to get them off all their medicines. But this is something that's common in the federal system, and then I think a lot of states have pharmacists doing this as well. It's a little bit more tricky in the private sector. The federal law just makes it a little bit easier for pharmacists to do it in the federal system, whether it's the VA or the Indian Health Service. But the idea, one, we have a ton of chronic disease. There's just not enough primary care providers that can manage it. But pharmacists being trained in medications, like, we can titrate amlodipine, so it's a blood pressure medicine for those who don't know what it is. But like, you don't have to see the doctor every 4 weeks to change your amlodipine dose. You can go to the pharmacist to kind of offload some of that chronic disease management off the physician or the nurse practitioner or provider, and while still getting that patient to get the outcomes we want: lower blood pressure, better blood sugars, etc.
Interesting. Now,
Yeah.
was there any formal training in this skill, or they kind of just threw you into the fire?
So I don't know, you might learn another thing, that pharmacists can do residencies. So I did a residency after I got my PharmD in 2011, and did a PGY1 residency in 2011 to 2012. So pharmacists and you don't have to do a residency to do this as a pharmacist, but I got a year of additional training on what we call clinical pharmacy. So I had a year's worth of experience doing the medication management that we talked about, managing chronic disease, working in different inpatient and outpatient settings where pharmacists are doing a little bit more than just filling meds and sending them to the floors, or filling them and putting them in a bottle. So there's the residency training, and we do there's PGY2s now for pharmacy. I mean, pharmacists can specialize in oncology, ambulatory care, cardiology, infectious disease, any number of things, pain, mental health as well. And then I also have a couple of board certifications. So getting board certified, you're getting that additional continuing medical education to be specifically trained in these areas as well.
Yeah, but I mean that's fantastic. That really you're doing this, providing the same role and function as myself. Now, some might argue that you're a direct vehicle for the pharmaceutical industry, so we should just get rid of all the physicians and just let the pharmacists prescribe and prescribe and prescribe. But we run into the same issue. We run
Yeah.
into exactly the same issue. And what did you want to say?
Oh no, I can hear that, and I think that there are some physicians like yourself that are like, oh great, pharmacists can help me, and there are some that are like, oh my gosh, they're just good at counting by fives and filling pill bottles. Why would you let them near my patients? And so I kind of joke that like providers have like there's no middle ground with pharmacists. It's like either like I love them, don't take them away from me, or don't put them near me. I will be making all the prescribing decisions. But yeah, I think we have to be careful. And I've seen this now. I recently took a job in the private sector, that direct influence that pharmaceutical companies can have on anyone who's prescribing. And I certainly am not a normal pharmacist. I'm a comedian. I'm an author, and I tell every patient that I don't like medicines as much as you don't like medicines. So let's try to work on getting you on the fewest ones possible, and only using the ones with the best evidence that are available, whether it's due to. And don't get me started on insurance. That's another state of healthcare. That's just a new area I've been learning to navigate as well, which is just a mess too.
Yeah. Yeah. Well, look, you're not the only pharmacist that understands the concept of deprescribing.
Correct.
And, it's just delightful to hear what you're saying. But with that in mind, we had a previous conversation that, this new class of medication, the incretins, the GLP-1 and the GIP agonists for diabetes and weight loss are all the rage. And, they've been around since 2005. And look, this conference is about deprescribing and medication. But once in a while, there are some treatment options that come along that can be helpful as a crutch. And so, for our audience, I want them to understand that Cory and I both are we're bridging the gap between nutrition and what modern medicine can offer. What are your thoughts?
Yeah, it's a sticky subject because I'm all, I rah in deprescription. And then in my daily practice, like I do prescribe medicines. So for your audience, like, I don't want to sound like a hypocrite. Sometimes if someone's blood sugar is 500, it's unsafe. We have to do something about it. But this new, like the specific class you're discussing, it's for a long time, all we cared about in diabetes with a medicine was, did it lower your blood sugar? And then there was this trial in 2008, the Accord trial, that showed that if we more aggressively lowered your blood sugar using insulin in this class called sulfonylureas, you were more likely to die. So your A1C was good, but you're more likely to die. And so fortunately now when we get a new diabetes medicine, we care about, does it improve heart outcomes, right? Because diabetes is a cardiovascular risk factor. Does it keep you from dying? Like even if it doesn't lower your sugars as much, does it improve these outcomes that we care about? Like, I don't know, living. So that's usually something patients are interested in doing. And so this class of medicines, as you say, it's walking the line of giving those dietary interventions. But I've also noticed I have several patients that have been obese for so long, metabolic syndrome for so long, that even when doing strict dietary interventions, they're just stalling, whether it's blood sugars or weight. And that's when you have that conversation, the risks and benefits. It isn't, here's your drug because this is a great thing. It's, you've tried this. You're working really hard at this. Here's this other drug. Here's how it works. Here are the risks. Here are the benefits. What would you like to do? And I always try to make that a shared decision-making with the patient.
Yeah. Well, my point is that I've been doing this for over 30 years and I still enjoy what I do every day. I like coming to work. I like to help patients and I still want to remain working in the healthcare system and to find some common ground and a way through it. So it's a win-win for everybody.
Yeah, I know that I was at a conference recently, went back to that class of medicines where we talked diet. And one speaker brought up that specific class that you were talking about. And everyone's kind of clutched their pearls like, oh, they're talking about a medicine. And then there's a lot of people in the audience that are patients who've had side effects and adverse reactions to medicines. And so having that, as a provider, going back to what I talk about with improv, a lot of it is developing that empathy. Like, why wouldn't someone want to take a medicine? Well, if they've taken, say, metformin and they fill up their pants because they got diarrhea, why would they ever want to take that again? Why would they trust us to give them another medicine that could give them that same side effect? And so, and from an audience member or a patient perspective, if you've been through the rigor of the healthcare system, I understand why you're frustrated. But also try to remember, a lot of us, we're doing our best with the limited resources we have and the limited time we have. And so trying, like you just say, striking the balance between when it's appropriate to write a medicine, when it's appropriate to keep doing the diet thing, and when we have to have those conversations.
Well, I wish you more time in your new position, because
Yeah.
I'm in a position where I don't work for any institutions, and I
Mhm.
kind of set the time, and so we
Yeah.
really have some luxury with time, and so if you have more time, you can really get into it with whoever it is you're discussing. So hopefully
Yeah.
that'll improve for you.
Yeah, well, I'll just learn to talk faster. That's okay.
There you
Talk and
go.
listen faster. So, and a lot of what we're able to do as a pharmacist is, you see a doctor every 6 months, every year. I can see patients every 4 to 6 weeks, sometimes in 3 weeks, call them in 2 weeks. So we get more touch points in that system. So if I can't get to everything I want to talk about this week, well, in 3 weeks, you do a few of the interventions we talked about, we can go in more depth about that medicine next time, maybe. So that, while I don't get that like depth per visit that we all wish we had, that the touch points I have throughout the year, kind of both from getting that information to them, but also, as we know, from a behavioral health standpoint, like changing behaviors takes a lot of work too. And it sort of is that combination of being that provider and that coach through that process.
Yes, very much so. And, I wanted to bring up the topic of medication. We have these email threads of the low carb community, and we go back and forth about all kinds of things, but recently talking about this class of medication, and, half of the group says there's a role for it, and the other half says you're crazy. So,
Mhm.
we're probably get some pushback, and that's why I wanted to bring up the discussion. And ultimately it's up to the individual
Yeah.
as to what path they want to go.
And I think pushback is good. This is where we learn new things, and we have a little bit of, if we can have conflict in a professional way that we don't name call, but we back our stances up with evidence, and we can have that. That's where we're going to learn. If everyone's always happy all the time, um, then I don't think that's the reality. Or as I think General Patton used to say, if everyone's thinking alike, then nobody's thinking. I'm glad that we have like disagreements. As long as we can attack it professionally and cordially, we're going to find we probably agree on 95% of stuff anyway. And it's that little nuance where you're getting that second opinion. And like for me, if I see a patient and they're like unsure of what I want to do with them, I tell them, get another. I'm happy to have you get another opinion, because there's always that chance that we're missing what we're seeing. There's always that blind spot. We don't know it. We don't even know we don't see. So we're going to have different opinions on things. And so that's just the nature of healthcare. And so half say it's okay and half say no way. All right, well, let's look at our reasons why, and try to find as much common ground as possible.
Yeah, so at our conference, we're introducing different speakers that may have some different points of view about nutrition, and in particular, we're
Mhm.
not really going to be talking about the healthcare system per se,
Yeah.
but it might cause a little bit of confusion. But I like this idea, where is nutrition headed, and we'll present some different ideas at the conference next year. And that brings me to the next point: is you know what was the professor who taught you about nutrition? How'd you learn about nutrition? They taught it in school, right?
I would say YouTube University, Podcast University. It's interesting. I mean, my conduit to the metabolic and low carb world was listening to a comedy podcast. Adam Carolla, he used to host Loveline, did the Man Show. You wouldn't think of him as a nutrition guy, but he had this guy on, Vinny Tortorich, who's been doing low carb for a long time. And Vinny had a podcast. My wife and I were driving up to Sedona and I'd never been to the Grand Canyon in 30 years of life in Arizona. So we went to the Grand Canyon. We had a lot of driving time, and I was like, I heard this guy on Corolla. He's kind of weird, kind of interesting, different idea. We should listen to him a little bit more. Let's find out. So it's just a little bit of curiosity led me down the rabbit hole many of us have gone down, and then read the books and all of the different authors, Nina Teicholz, Gary Taubes, all of them. So it was a self-education. I did not learn much at all. Like if I learned anything, I long forgotten what I learned in pharmacy school.
How how long ago was that experience with Adam Carolla and Vinny?
7 years. So it was the
Wow.
end of 2015 into 2016. So we're looking at almost 7 years
And,
now.
and your wife was influenced as well. She's works at Verta, if I understand.
She does. Yeah. She's a nurse practitioner then.
Yeah. Oh gosh, you're both in healthcare. I married a lawyer. I was going to stay away from healthcare professionals.
That's, I, at risk of angering my wife, that was probably a good idea. Like we have plenty to talk about that isn't our jobs or healthcare, so it's fine. We have our own hobbies and interests, but I could see that like those healthcare families could just like get bogged down with all the, like, unfortunately, like the complaints of the day, right? We all deal with the challenges, but also this, like with her now, she's just, she talks about successes too, which is really cool as well.
Yeah. Well, look, we love Vinny Tortorich, and he's been
Yeah.
friends with Adam Carolla for a long
Mhm.
time. And Vinny is the no sugar, no grain guy. And in fact, we're
Mhm.
going to be on a podcast with him next week. And
Uh-huh.
he's one of the guys, he has some great social media
Oh
videos,
yeah.
and he is absolutely ripping on the pharmaceutical commercials the last couple of weeks, including these classes of medications that we're going to talk about,
Yeah.
that we were talking about. And he'll probably give me a hard time about it next week, and I'm going to be sure to bring it up.
Yeah. Well, and I think that's getting back to what we're doing with this conference. Why is he so effective? He's relatable. He can communicate things on a patient level. I mean, no sugar, no grains, which is his trademark. How simple is that? Like we complicate things so much in healthcare, but when sometimes the simplest interventions are going to get the best outcomes. So if you tell a patient no sugar, no grains, like they'll probably already be 25 to 50% better than what they were doing if they had, if they were dealing with the metabolic syndrome or diabetes or obesity, cutting out a lot of those processed things. And he's done it in an entertaining way. He got me into the world because of his personality. And so that goes back to what healthcare could be. It could be fun. It could be engaging. It could get you excited about fixing your health.
So you may have learned about social media online, but just to let the audience understand, there's really a lot of evidence today to back up some of these approaches to nutrition, and that's really the point of the conference.
Yeah.
That the general public's invited, and the presentations are as evidence based as they can be. They get approved for CME education, and so we the fun thing about social media is it really challenges the norm,
Mhm.
and it's changed everything.
Yeah, well, and I like what you say, just kind of going back to some maybe more different approaches or controversial speakers you might have here. For those of us in the kind of low carb world, remember, we were challenging the norm. And now we have to be careful on our own of being in our own echo chamber. So I think getting those outside voices is important. It's important to not just listen to our own voices over and over and over again, so that we don't make the same mistakes that mainstream nutrition has made for the last 50 years. So it's like we think that, we can be the exception, but everyone thinks that they could be the exception. So we need to have those voices, because that's why we have these conferences, because every year I go to them, I learn something new or different, and I change my approach. And what I did in 2017 is different than what I do in 2022. And that's okay. That's the fun part, is growing and learning and developing these different ideas and being challenged and being better for it.
Yeah, well, great, Cory.
Yeah.
Well, we can finish up, and I always like to ask, what do you enjoy about coming to these events?
What do I enjoy? Well, for the first time, I'll get to enjoy being on stage at one of these events. So that's what I will enjoy. But what I love about these events are how kind the speakers and the experts are. You're so accessible. Every time my wife and I have gone to one of these events, and with her in her current position, and then some of the questions we've had with our own health journeys, with having kids, with her being pregnant in the past, every time we go, we have that accessibility to the experts who we've seen on social media, who we've read their books. We go up to them and you just talk to them, and they're so kind and they're so thoughtful and they're so thorough. And I think that that's something that separates this from other conferences or other worlds, is that you can go and learn directly from those people that you have been learning from, and get to asking those questions. And so having that access, and then what else do I love? The relationships that I've created while going to these. Like my wife and I have gone to several other of these metabolic and low carb conferences, and you see the same people over and over again, and you're just excited to see, like, how are your kids? How's your practice doing? What's new? So I think if you're on the fence about going to this, like, go and make friends. Like that's what I love. Like I've made so many friends at these, that then when I go to ours here in February, I get to see the same cool people over and over again and check in with them. So I think, so to sum up, the accessibility of the experts and the fun and relationships that are cultivated there.
Excellent. And so how can the audience find out more about you, Cory?
They can go to CoryJenks.com. And so my parents were cheap. They did not buy a vowel in my name. So it's CoryJenks.com. From there, you can get to my book, Permission to Care, Building a Healthcare Culture That Thrives in Chaos. It's on Amazon. From there, you can learn about the speaking that I do. From there, you can get to I write a thrice weekly newsletter for healthcare called Get Through Your Shift. So it's just a short email that you get 3 times a week to help you get through your healthcare shift. A little knowledge, wisdom, and humor there. And then from there, you can also get to all my social medias, but it's just easy to start at the website and branch out from there. But I would love to connect with anyone who's listening, who's a little bit curious about this pharmacist that does comedy. And if you're really curious, register and I'll see you in February and I will be accessible and talk to you in person.
Well, thanks, Cory. And to our audience, if you want to hear more from Cory, and we're really excited, I think he's going to add another level to the conference and make it more fun, educational, and entertaining. And if you want to hear from our speakers, please consider joining us in February. And for more information, please visit lowcarbconferences.com. So that's all for now, and we'll catch everybody next time. And thanks again, Cory.
Thank you.